Now at 5, a big push to help those with mental health problems and drug addiction. Today, former Congressman Patrick Kennedy came to Connecticut to testify on a bill that would require insurance companies to treat mental illness the same way they treat other illnesses. Our chief Capitol reporter Susan Raff is live at the Legislative Office building in Hartford with more on the day's developments. Susan.
Denise, Patrick Kennedy has certainly been open about his struggles with mental illness and addiction, and he says right now what he's trying to do is help others. He says there are plenty of services out there for people, but the problem is that some insurance companies are not paying for them.
We don't want any more separate and unequal treatment.
Patrick Kennedy has been vocal about his own struggles and has taken the lead on removing the stigma on mental illness.
We don't want to be told when we come into the hospital that your illness isn't the same.
This is his second visit to Connecticut to push insurance companies to step up to the plate and treat illnesses, all illnesses, the same. This summer, he was with Ned Lamont, who was campaigning at a treatment facility in Hartford. Now he's supporting legislation that will require insurance companies to prove they are covering what they should be and that medications be covered as well. Aetna recently paid a fine in Massachusetts for creating too many barriers. It is now taking steps to improve mental health care. Several states have taken action.
It places the burden of improving compliance on the insurers. Instead of what they usually do is they just dump a bunch of information on a state insurance department and say, you figure it out.
Alec told me that I should be honest and that everyone should know about the struggles he has had to endure from a disease that has taken the lives of so many of his young friends.
Dita Bargava knows the pain of addiction. Her son Alec was bipolar and died from an overdose of opioids.
He was in recovery and then he would relapse, and we went through several cycles of treatment, all that every cycle we were challenged with the barriers of insurance approval.
Similar legislation was introduced last year. It passed the Senate, it went to the House, but it was not voted on. This year, many are hoping that it will get voted on and it will become law. In Hartford, Susan Raff, Channel 3 Eyewitness News.